Welcome back to AZH Wound Center in Milwaukee, Wisconsin for another edition of the Wound Care Window. Got a few patients that I'd like to share with you. This is unusual. We've not done two patients back to back. And I want to highlight a technology that you need to know about in the wound care clinic. It's called Edema Wear. In fact, here it is right here. This gentleman has been kind enough to allow us to talk about his case. He sustained an injury to his leg, a little bit of trauma, and subsequently developed a hematoma. He is on anticoagulants and had a very extensive hematoma that was not open, was not draining significantly, and had some early signs of a cellulitis but wasn't grossly infected. And we decided to manage his hematoma in a closed fashion. I like to do that as much as possible. When you open and drain a hematoma, obviously it has a lot of morbidity and problems for the patients. We like to manage them closed when we can, and I want to illustrate how we've done that with two patients actually. So I'm going to show you a photo of what this gentleman looked like on initial presentation, and we put him in some compression, and one of the compression devices we like to use is Edema Wear. Edema Wear is developed by my actually good friend and colleague, Dr. Martin Winkler. He's a vascular surgeon extraordinaire. And the design of these fuzzy wells actually provides some compression on the surface as well as deeper, and it works very synergistically with the lymphatic system to really decompress the extremities. So this is the way the patient returns to us here, and let's just take the Edema Wear off, Terry. And we're using a dry dressing, which you see is dry. Here is the hematoma. Now again, you're going to compare last week's photo to this week. You see there's a significant decrease in the edema, significant decrease in the erythema. It's not draining, and so the management of this hematoma in a closed fashion is the right thing to do. If you also look at his leg here, you see the edema is much decreased. And I want you to come over and look at the side of his foot. And again, we're going to compare photos of the side of his foot from last visit here, as you'll see, as well as the dorsum of the foot, and you'll see this photo here. Now look today. We have marked decrease in the swelling. The ecchymosis is profoundly improved. So this is an excellent illustration of the use of Edema Wear for management of a closed hematoma, as well as someone with a very edematous and ecchymotic leg. Terry, let's go ahead and show them how it goes back on. With my able-bodied assistant and nurse manager, Terry. You can see that goes on really well. And how did this feel after wearing this? Did this improve your pain, would you say?
Definitely.
Good.
Definitely, yes.
And you've certainly noticed a decrease in the amount of swelling that you've
Yes,
had.
yes.
And you're able to wear the Edema Wear at night, too, through the night, right?
All night.
Okay.
No problem. I leave it on.
All right. All right, we'll be right back. We're going to stay the same course. I think we're in good shape. I appreciate you participating here today.
My pleasure.
We're going to walk right next door here, okay? So this young lady returns to us and has again allowed us to feature her story in the wound care window. You can see that she's had a very similar injury to our previous gentleman, with a really significant injury in this area. And I'm going to show you a photo from her initial consultation. You can see that she was at risk of having to have that hematoma indeed. But again, managing it in a closed approach, and the fact that she was not infected at the time, trying to keep her from having a big incision and open wound across the knee, we managed it closed. And you can see the impression of the fuzzy wells. We've got a nice imprint from the Edema Wear. The Edema Wear has really decompressed the tissue and kept that hematoma from having to require an IND. How has this felt for you after the compression therapy, the Edema Wear?
Feels great.
Yeah, and the pain is better?
Oh, absolutely.
Okay. And we had a bet going, right? You said that we were going to have to open this up, and I said not. And what did we put, $20 on it?
We were going to do $20.
But you decided not to.
Right.
So we're good, we're good. Well, I'm glad you're better, and thank you for allowing us to share your story. So thanks for joining us on this edition of the Wound Care Window to feature a technology that we use often, in fact probably on a daily basis here at AZH, Edema Wear. If you don't know about Edema Wear, I'd encourage you to investigate. Contact Dr. Winkler directly. He is an excellent teacher and clinician. He's more than willing to share with you his technology, which you really need to know about. Until next time, thanks so much.